Bonjour à tous.
Thank you, Mrs. Edwige Poncel, for inviting me to this webinar. People suffering from spasmodic dysphonia are confined and cannot have their usual botulinum toxic injections or vocal rehabilitation. Today, I'd like to provide them with speech therapy advice. Your voice may have been deteriorating for some time and you may experience tiredness or shortness of breath. No wonder. I don't have any magical tricks to show you that can make you speak normally, like this, in a snap, especially since there are so many clinical forms. As with surgical treatment, the exercises that you can do at home should be tailor-made, just for you. Several physical exercises can be practiced by anyone, with great benefit and no contraindication. They will help you improve your voice and fight the stress and anxiety that some of you may experience. However, regarding vocal exercises, I will ask you to carefully listen to me, because some exercises can be very beneficial to some patients and harm others. They can even worsen your symptoms. I will try to explain to you how to avoid unwanted and potentially dangerous mechanisms. Then I'll show you some exercises that you can do quietly at home. In the course of this meeting, I will not show you complex exercises, which are usually approached with an experienced clinician at the office. These exercises may be different, depending on the kind of dysphonia you have, with laryngeal spasm, with respiratory spasm, or both. But first of all, there are three things to keep in mind. First, what can be called reaction effort. When they experience spasms, most people with dystonia react by straining. Most of you want to force their vocal box in spite of the difficulty. This is understandable, but this reaction is very harmful. It increases the psychomotor tension, which in turn causes an intensification of the straining, and so on, until the escalation eventually results in even more marked spasms. When speaking, spasms appear. Instead of decreasing the tension, most of you have developed a reflex to increase it. However, when laughing, for instance, an energy discharge will cause a sudden drop in inner tension, and the voice will normalize. This possibility of lowering inner tension is very interesting for you. The more I try to speak well, or write well, or play a musical instrument well, the worse it gets. In spasmodic dysphonia, my efforts to speak well lead to even greater speech difficulties. This is why, in everyday life, permanent control, constant monitoring of my speech on a voluntary basis is truly harmful. And finally, third observation. Some of you may use facilitating or regulatory mechanisms. They vary greatly from person to person and from time to time. These are what we call conjuring gestures. You will be able, eventually, and to a certain extent, to use these facilitating mechanisms. In spasmodic dysphonia, some patients manage to emit a completely normal voice by placing a finger or an object on the corner of the mouth, for example. Here is an example. Mrs. B conjuring gesture with a teaspoon.
C'est une cuillère à café.
D'accord, et pourquoi vous la gardez en place?
Parce que je parle mieux. Je parle mieux, les sons sortent mieux. Je retrouve presque ma voix en parlant.
Presque votre voix, d'accord.
Presque.
Et maintenant, je vais vous demander de l'ôter, de l'enlever, de retirer, voilà.
Et avec ça, j'ai la voix qui déraille et je repère les syllabes et les mots.
There are many other facilitating methods. For example, using a completely whispered voice, or even speaking on inspiratory time, by touching the cheek with a finger or a key, or even just pointing a finger in the direction of the face or neck, or by raising or lowering the head.
Je peux parler comme ça, en fait.
Normal.
Donc là, après...
Il n'y a plus rien. D'accord.
D'accord.
Avez-vous d'autres gestes?
J'ai le même, mais dans ce sens-là. Voilà.
Oui, oui. Allô, allô, bonjour monsieur.
Allô, allô, bonjour monsieur.
Elle est pas mal,
bonjour
celle-là.
docteur, c'est pas mal, ouais.
C'est cool.
Oui, enfin c'est... Voilà.
Voilà. Bon, c'est déjà pas mal.
Je crois qu'avec le nez
Eh
bouché
ben oui,
aussi,
que les
c'est
bouchées
pas
aussi,
trop
c'est pas
mal.
mal. Et si vous... Là, il n'y a plus rien. Vas-y, bouchez le nez.
Là, je peux à peu près, c'est correct.
Et là, avec l'osioïde ici, là.
Là, c'est pas mal aussi, ouais.
Desserrez un peu. Là.
Oui, parce que... non, là, c'est pas mal aussi.
Pas mal.
Ouais.
Et si vous mettez juste le doigt comme ça, juste à peine. Oui, là, c'est pas mal, non?
Là, ça...
Là, je parle normalement.
Bah, par contre, j'étouffe un peu, là, tu vois, là, ça... Non, si, quand même. Là,
Bon, alors, serrez un peu plus le kiki pour
avec
moins
les
étouffer.
deux, voilà.
Là, vous n'étouffez plus,
Là,
là.
j'étouffe pas, là.
Alors, on peut trouver plein d'autres choses.
Oui, apparemment. allô, bonjour, bonjour. Là, c'est relativement déstabilisant de se dire qu'avec le doigt là, j'arrive à parler. Que je mets là, vous voulez dire?
Oui, sur le côté, là.
Oui, là.
Là, voilà. Essayez de parler comme ça.
Bah là, j'arrive à parler, bonjour.
Another example of a facilitating mechanism is reading aloud. Reading aloud may facilitate voicing in some cases. But be careful. Most of the time, reading, especially aloud, considerably aggravates the disorder. In this case, it's contraindicated. Here is the case of a young woman who struggles, in vain, to try to normalize her voice by reading aloud at home all day long.
J'arrêtais la note devant la porte. Il occupait au-dessus les drugstores.
Another example is when you call someone out. This might be completely impossible for some of you,
Vous pouvez appeler à voix forte, comme ça. Oh!
while this is possible with a small head voice, for example. Likewise, the current conversational voice can be high-pitched but still normal. Yet, another mechanism concerns the singing voice. The singing voice is most often impossible or very disorganized. In other cases, it may be completely retained or partially affected, sometimes on the bass, sometimes on the treble. I fear that we're running out of time to name other facilitating mechanisms. Third, there are facilitating mechanisms, not necessarily those that appear magical. They are very variable for each person. Now let's see what you can do and especially not do at home during this period of lockdown. What you should not do. First of all, as I said, too much focusing on the goal to achieve and relying on your will to speak well is particularly harmful. It is contraindicated even if it gives transient results. Unfortunately, many of you are generally unaware that this way of reacting to the disorder with voluntary effort is the main aggravating factor. In other words, stop making excessive efforts to produce your voice. If this is your case, it is quite unnecessary to do vocal exercises. Moreover, they are contraindicated by your speech therapist at the beginning of your voice therapy. You should also know that vocal rest and vocal silence can also be harmful. So what's to be done? The dystonic process feeds on the great efforts some of you make to speak despite the spasms. Fortunately, the toxin injections, by paralyzing certain muscles temporarily, allow a break in this struggle. This break allows rehabilitation to work more effectively. So what kind of exercises are you going to do? Non-vocal exercises or vocal exercises? For non-vocal exercises, every kind of muscle relaxation is great to practice, regardless of the type of symptoms you have. Relaxation, of course, but above all, muscular control. Second, exercises that aim to increase the skills of the tongue, jaw, and lips. These exercises make it possible to move each of these three organs independently from the two others. Second, exercises that aim to increase the skill of the tongue, jaw, and lips. These exercises make it possible to move each of these three organs independently from the other two. Third, breathing exercises, standing or lying down, especially if the spasms are respiratory. Regarding vocal exercises now, you can do vocal exercises, but be careful. They may be contraindicated in some cases. They should be stopped immediately if they cause even more severe spasms. I will come back to this in more detail, because this point is fundamental. First, here is a short sequence showing how to achieve muscle relaxation with simple stretching movements.
Vos mains comme ça, là, tirez par le... Voilà, et puis inspirez fort en tirant. En inspirant fort, inspirez fort. Et lâchez comme ça. Respirez 2 ou 3 coups comme ça. Sans effort. Vous avez une tendance à faire beaucoup d'efforts en inspirant. Encore un coup. C'est très bien. Oui, ça va. Et puis à nouveau, tirez de l'autre côté en tournant la tête à droite. Inspirez fort. Et c'est agréable, profitez-en. Et lâchez tout. Et quelques respirations tranquilles à nouveau. Et encore.
I will now show you an excerpt from a relaxing exercise. I believe that this is the best indicated exercise in the rehabilitation of spasmodic dysphonias, to be done daily at home. It is called rolled respiration, or respiration ramée in French, or the Four Seasons. It relies on the coordination of breathing with arm movements. You will find it perfectly described on YouTube. Search for respiration ramée.
Par commodité, on dit que chaque temps représente une saison. Alors le moment de l'inspiration, c'est le printemps. Après, vous avez l'été avec les bras en l'air, là, c'est l'été dans l'herbe. Hein. Voilà. Et ensuite, vous avez l'automne, hein, c'est les bras qui se ramènent au point de départ, avec une espèce d'impulsion pour monter, et puis ensuite une espèce de retenue pour descendre, pour se poser gentiment de chaque côté de vous. Et là, vous avez une pause expiratoire. Et puis quand il faut inspirer, ma foi, c'est vos bras qui vous donnent l'air en décrivant de chaque côté de vous des deux demi-cercles. Quand vous voulez, vous partez, voilà, allez-y. Et vous restez là et pensez, le poids de mes bras tient mon thorax levé. Et puis quand il faut expirer, par le nez surtout, ben vos bras attrapent en vitesse le nord, et puis voilà, vous expirez, mais tâchez que tout ça soit facile.
Another exercise widely used by speech therapists, especially when respiratory spasms are predominant, is the relaxation exercise called open eyes, les yeux ouverts. You can also find it on YouTube by typing Relaxation les yeux ouverts. This involves gradually tensing each limb and relaxing it immediately. Each tension relaxation is interspersed with one or more sighs. Here is a short excerpt to give you an idea.
À nouveau, soupir. Crisper la main et l'avant-bras droit très progressivement. On lâche. On attend un petit peu. Soupir.
I will now show you what we call jaw tongue exercises. They are not always easy to achieve, but try to practice them at home in front of a mirror.
Mettez donc un index vertical sous le menton. Voilà, alors, normalement, ça devrait être tout mou. Voilà. Pas terrible, et ça devrait rester aussi mou que lorsque vous n'émettez pas de son. Vous voyez, votre plancher musculaire est en train de pousser votre doigt. Alors ce qu'on peut faire, c'est un exercice très simple qui consiste à faire travailler la langue et la mâchoire. Vous ouvrez la bouche tout simplement et vous vérifiez si votre langue est bien plate à l'intérieur de votre bouche. C'est le cas, donc on est bon. Au début, quand vous êtes venu ici, rappelez-vous, il y avait des tensions formidables, extraordinaires. Là, apparemment, vous savez ouvrir votre bouche sans entraîner des tensions dans votre cou, ce qui est déjà pas mal. Alors vous faites ce qu'on appelle la carpe. Vous ouvrez la bouche, vous la fermez, et vous la réouvrez en vérifiant que la langue est restée à sa place. Allez-y plusieurs fois. Voilà, ça c'est déjà un exercice tout simple, mais que tout le monde ne fait pas forcément très bien. Maintenant, avec la langue, vous sortez une langue toute plate. Voilà, vous la rentrez et vous la sortez toute pointue. Pointue à l'extérieur. Hein? Plusieurs fois, plat, pointu. Alors pour plat, il faut bien la sortir. Ouais. Voilà, bon. Voilà. On peut faire un autre exercice qui s'appelle la tondeuse, c'est-à-dire une lame mobile, la mâchoire, et une lame fixe, la langue. Donc ouvrez la bouche. Voilà, oui, c'est pas mal. La langue est bien à sa place. Le menton va à droite et à gauche. Voilà. C'est parfait, vous le faites très bien. Ce n'était pas le cas au début de la rééducation. Et enfin, on peut faire un ou deux autres exercices. Par exemple, langue droite, gauche, droite. En ne bougeant pas le menton. Voilà. Voilà. Voilà.
Among the non-vocal exercises I just showed you, none are contraindicated. On the contrary, training in this type of exercise should be continued at length. This is why your rehabilitation is sometimes long and may not include vocal exercises. Let's talk about the vocal exercises now. First, it's about sighing with sound. By practicing the relaxation with open eyes, one gradually learns to sigh more and more comfortably. These sighs, or even voluntary yawning, can be sounded in a second time. It does not have to be a voice production, but rather a vibration during the two inspiratory and expiratory phases, in a slow and longer breathing. But be careful. If a second attempt at a sounded sigh fails and turns into a spasm, it should not be repeated. Simply try to remember what it felt like when you successfully sighed. The same will be true for all vocal exercises. Focusing again and again on the idea of finally free vocal emission can lead to the onset of a spasm. If not, once the floor of the mouth is relaxed, we can try to make some sounds without any rush. Sometimes you will have to stop after just one try, as I said earlier, especially if the second one results in the onset of a spasm. A simple sound production is the exercise of the fly. If the fly exercise is performed without spasm, with a normal voice and with ease, it can be repeated several times during the day. If, on the contrary, a spasm appears at the start of the vocal emission,
avec un petit port de voix comme ça. Ma.
After trying once or twice, we need to stop and get back to the non-vocal exercises mentioned above. We can try to go further and try the exercise ma, me, mi, mo, mu. Let's now see how some facilitating techniques, including conjuring gestures when they exist, can help perform more easily various vocal or non-vocal exercises and then make the correct vocal gesture. At the level of muscle relaxation, at the level of phonatory breath, and at the level of the vocal cords. The facilitating mechanism should only be used during your training, constantly checking for total absence of strain. These processes are the first step in an attempt to regain the normal mechanism of voice and speech. Since my voice is normal when reading aloud, then I read aloud, making sure to use my phonatory breath correctly. Slight withdrawal of the abdominal wall and inspiratory times. This kind of exercises is rather a breathing and verticality exercise, not really a vocal one. If reading aloud is a disaster, then I immediately stop it. If I can read correctly only when I breathe in, then I should immediately stop it because it's not physiological at all. If my voice is normal while singing, then I read and sing on a single note. This is what we call the chant talk, called recto tono, or single pitch.
La la la, c'est ce qu'on appelle la lecture psalmodiée sur une seule note, recto tono. Oh, bonjour monsieur, etc. Un texte de littérature. Puis après, on peut lire sur différentes notes. Bonjour monsieur, etc. Si tout va bien.
Then try on different notes if the first one works. But I don't usually speak and sing when I go shopping. If my voice is normal only when I place an object in the corner of my mouth, then I read or utter various sounds quickly, quietly. If my voice is normal only when I place an object in the corner of my mouth, then I read or utter various sounds quietly with that object and without excessive tension. This is how I get the correct vocal gesture back. Finally, since your whispered voice is preserved, you can practice in front of a mirror the exercise called words in mouth. It will help you recover a good mechanism of voice and speech. It will allow you to find what is called the normal core articulation of speech.
Je vais le faire en ralenti. Si je décompose les actions, l'action de ma bouche d'abord. Vous voyez, je fais. Qu'est-ce que j'ai fait? Je n'ai pas encore dit bonjour, j'ai mis ma bouche en forme de on. Ça, c'est le mécanisme normal. J'ai pris un peu d'air en même temps. C'est normal, il y a une inspiration naturelle. Donc, j'ai fait ça. J'ai encore rien dit. Après, je vais vocaliser. Donc, je vais faire bon. Le on vient en numéro 2. Ce n'est pas comme à l'écrit B-O-N. Bon, le on vient après. Vous voyez, j'ai rien dit. Bon. Et c'est là que mes cordes vocales vibrent. Et c'est là que mes muscles expirateurs travaillent. Donc, je fais travailler mon diaphragme, ma bouche dans la bonne forme, mes cordes vocales et mes muscles expirateurs en même temps. Vous voyez, on remet la mécanique à sa place. Donc on fait ça au ralenti, bonjour, etc.
For instance, when I say bonjour in French, look at what I'm doing. If I break down the actions of my mouth, breathing, and vocal cords, here's what I do in slow motion. First, I take in some air. My diaphragm muscle acts smoothly while putting forward my lips to form the sound on. This affects the muscle of my lips and my cheeks, and only then I vocalize the on sound. My vocal cords vibrate and use my expiration muscle. Bonjour. In the words in mouth exercise, the movements, we will call them gestures, will be executed slowly with accuracy and any necessary facilitating gesture. The existence of vocal and/or respiratory spasm, whatever the cause, disrupts the mechanism of voice and speech. This is the exact complex mechanism we try to find back, but always gently and quietly, with no strain. This problem could be compared to a door, which can hardly be opened, and I don't quite know why. Then there are two solutions for me. Either I smash it open with my shoulder because I don't know how to do otherwise, and too bad for the damage. Or the other solution is to learn again how to turn the handle. It is up to each of you to try what works best to regain the normal mechanism of the vocal gesture while waiting to resume your rehabilitation. Thank you for listening. Does anyone with spasmodic dysphonia want to try doing an exercise, say word in mouth, online now with me?
Merci à tous, bonne fin de journée et excellent week-end.
Bonne journée.
Au revoir.
Au
Au
revoir.
revoir.
Au revoir.
Merci.